See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
Hey, See You Now listeners, Shauna Butler here. Given that it's February when Heart Health, Valentine's, Black History Month, and the American Football Super Bowl happen all at once, we're having another listen to our fabulous episode, Tackling Black Men's Health, where we meet nurse practitioner Julius Johnson and learn how he's combined his work as a football coach, clinician, and nursing professor to reach Black men with the aim of improving their health. We learn about CPR training and the emergency preparedness work he launched with youth football leagues in New York City to keep youth athletes safer, but also as a play to increase trust and access for men to talk about and take better care of their health. Since we last chatted, he's had a lot of interest in what's necessary and needed to make every playing field safer. So at the end of the episode, we've added an update from JJ where we go deeper into the details. Let's go, go, go.
Black men, we have higher rates of hypertension, diabetes, cholesterol, stroke, lung cancer. You look at all the things that we suffer from, and you see people not utilizing the services to prevent these diseases. Why are people not utilizing them? They don't feel safe in doctor's offices. Being in a unique position where I can see a lot of Black men, whether that's through football, through barbershops, through the Black Nursing Association, or through just walking and really paying attention in my community. It builds a relationship with those men. And as long as I can build a relationship, we can have future progress.
Welcome to See You Now. I'm Shauna Butler. Over the past 2 decades, there has been growing interest in improving Black men's health and addressing the health disparities affecting them. Despite the interest, evidence, and interventions, the health of Black men consistently ranks lowest across nearly all groups in the United States. Public health problems, social determinants, and lingering levels of distrust and not feeling safe in healthcare settings play a significant role in Black men's poorer health and their shorter lives. History is filled with instances of medical mistreatment, both on the individual and community-wide levels, that have eroded the trust Black Americans have in healthcare institutions and clinicians, and significantly contributed to the health disparities Black men experience and suffer. In this episode, recorded on the road in the midst of the UN General Assembly, at the Stories from the Heart of Health in New York City, we cheer for a nurse as he shares his stories about how he's supporting Black men's health by meeting them in places where they feel safe, familiar, and confident. Listen in.
Good evening, everyone. Welcome to an evening of storytelling. My name is Stephanie Friedhoff. I'm a co-director of the Information Futures Lab at the Brown University School of Public Health, a longtime journalist and storyteller, and we're here tonight to hear stories that come from the heart. The ability of stories to bring us a window into the worlds we don't inhabit, the experiences we don't have. That's what's important about tonight and why we're here. In this fight for equity that I think everybody in this room is committed to, but still takes all of us to be aware every day. Our next speaker is going to be talking about that a lot. Julius, who's a professor and director of nursing at Long Island University, and he will share his story next. Thank you.
Thank you for that, Stephanie. My name is Dr. Julius Johnson. Everybody that knows me calls me JJ or Dr. J. And yes, I have a doctorate of nursing. I am the president of the Greater New York City chapter of the Black Nursing Association. I'm an associate professor, chair, and I coach football. And I don't say all of that to brag, but I say all of that so I can tell you where I actually come from. I'm from Brownsville, Brooklyn, New York, which has the most New York City projects per square foot in the entire United States. I have friends that were killed as I was growing up. I have uncles and family members and friends that died prematurely. And I say that because it has created a frustrating issue of how do we get Black men to care about their health? For those of you who don't know, Black men has consistently ranked the lowest in terms of health outcomes. Cardiovascular disease, diabetes, hypertension, prostate cancer, lung cancer, you name it, we tend to either be on the bottom of the barrel or near the bottom of the barrel. So for myself, as someone who come from this neighborhood but have accomplished all these great things, I'm supposed to be responsible for creating some sort of a bridge, right? And to give you a running joke that's on Instagram in terms of how much men don't know about their own healthcare, there's this dad, or this guy, he goes to his wife and he's like, honey, I'm on the phone with the doctor's office and they want to know what my DOB is. And the wife was like, your DOB? What are you talking about? And he's like, I don't know. They asking me for my DOB. So I'm asking you, what's my DOB? And the wife goes, you mean the day you was born? And he's like, oh, yeah, I was born on a Wednesday. I think it was nighttime. Right? So, but it's an accurate depiction of how much we don't take care of our own health. So one of the things that we set out was, where do we first find these Black men? Because you have to find them before you can even get them to meet a doctor. Then also, where do they feel safe at? Because it has shown over and over, they don't feel safe in doctor's offices. They do not feel safe inside of hospitals. There's a feeling of you being rushed. There's a feeling of you not being heard. And most importantly, it's just a feeling of you not being seen overall when you go into these spaces. So how do we change that? And one of those ways was, let's get them in a safe space. And I don't know about the rest of the men here, but men like myself, one of the safest spaces for us is barbershops. Like when I tell you, men go to a barbershop on a Saturday or a Friday night and will not come home to their wives until as late as possible, right? You walk into a barbershop and you can smell the fresh scent of aftershave. You can feel the hot towel on your face. You can feel the alcohol burning. You can hear the laughter when you walk in. And a barbershop is just great and it's amazing. So we decided, how do we go there where they already visit and they feel safest at? On top of that, a barbershop also serves as therapy for counseling. It serves as violence prevention. You serves as political debates. And then everybody thinks they're also a sports expert in a barbershop. Right? So we decided to leverage the fact that we come from these neighborhoods. We know what it's like to be in a barbershop, and we're going to leverage it with us being healthcare experts and how that we can now reach them and talk to them in these barbershops. So we had some great partners over in Sacramento, our Black Nursing Association chapter there, and we decided, let's start doing barbershop health talks. Let's stream them live, sometimes once a quarter, but then let's also just do them normally by ourselves. And it opened up this gateway to talking about health in a very unique instance. Like there was this one young man that was having digestive issues and he just felt ignored by his primary care provider and he was over it. But he was saying, I know there's something seriously wrong with me, but I can't understand why and I'm frustrated. And I had my barber just spin me around in a chair and go, hey, this is Dr. J, meet him. And he's looking at me, right? Because obviously I don't have a white coat on, I don't have a shirt, a tie on. And he's like, you have a doctorate? So after verifying to him that I'm indeed a doctorate, we started having these conversations about his health. What are you going through? What are you eating? What does your stool look like, right? Who are you going to see? Where's your provider from? Are you seeing a specialist? Let me show you where I can send you to. It worked, and it started working well. And we started replicating these things. I remember having a conversation when the vaccines came out. And one of the biggest things was, we are not taking the vaccine. We don't trust it. We don't know where it came from. But then we was able to sit down and have those kind of conversations and build trust to the point where they then got those vaccines. And then now it's just creating healthcare ambassadors out of barbers, out of other men that come. So now we don't have those conversations where these men don't know their DOB, right? Thank you all for having me.
So JJ, you are quite the storyteller. You had the opportunity during the UN General Assembly of 2022 in New York to be part of an event that brought together the stories of frontline healthcare clinicians. And the focus was on health equity. Can you share just a little bit about how you got on the radar of being able to share your story with folks who are bringing together the nations? When you think about the UN General Assembly, everybody from around the world is there. And we were hearing stories of clinicians, specifically nurses, who are in those daily interactions, taking care of people and seeing health inequities and the fact that they're very similar all across the world.
Absolutely. So that story really began with COVID, and it began with the way that it ravaged through the Black and Brown community and how folks in the Black and Brown community started dying at disproportionately higher rates. And what happened was the vaccine was coming out, and there was a long-standing history of mistrust between the Black community and healthcare, and especially the United States government. I did not want it to be similar to the AIDS crisis in terms of this happened to the Black community and it wasn't an immediate response or immediately holding of the government's feet to the fire to make sure that we receive the proper care. And we started doing vaccine education. We started doing research education before the vaccine even came out. Then we were fortunate to have some folks at Johnson & Johnson decide that they were willing to sit down in a meeting and talk about their vaccine that wasn't even out yet. Just talk about the trials. So I told them, we're going to have a Zoom. It's going to be maxed out with 300 people. And we're also going to allow people to unmute and ask their own questions. So as we were having that conversation, we unmuted and we were letting people talk. And at that time, there was a lot of webinars that was happening surrounding the vaccine. So people in the community could listen, but they couldn't really partake and talk and speak. So people were unmuting themselves and they couldn't believe that they were actually live. Like they were like, am I here? Are you sure I'm here? And people are writing in the chat laughing like, yes, we can hear you. We can hear you. So they asked their question.
Am I unmuted? The phrase of 2020 and the pandemic phrase. Yeah.
Right. So they asked their questions and the vaccine trial team answered all of the questions. I played the buffer in helping translate some of the questions to the scientists and translate some of the stuff that the scientists were saying back to the community members. And it was success. It was a hit. We maxed out the Zoom for that full hour and a half, 2 hours. And it was a great conversation that built up trust within the community. Then we start running a vaccine clinic. And then after that, some folks at Johnson & Johnson asked about some of the other stuff we were doing. We got to the barbershop talk series. And I did an interview with them regarding the barbershop talk, shared some of the stories that I've learned from our barbershop series with men's health, some of the ways that men look at their health, some of the ways that men avoid going to the doctors and understanding why and how we can reach them really in their community. And as they started hearing stories, they asked me to come to UNGA and share some of those stories, which I was excited to do because if you are not spreading what you are doing, then really it's going to die with you. And everything that we do, we want to make sure that it spreads to other communities so that it lives on because it benefits the community.
I was in the audience as you shared your story. And one of the things that really grabbed me is the way you introduce yourself. I have a doctorate of nursing. I'm the president of the Greater New York City chapter of the Black Nurses Association. I'm an associate professor and I coach football. And you say, I don't say all that to brag, but I say that so I can tell you who I actually am, where I come from, so that people could really know who we were listening to. And then you shared some really interesting statistics about men and their health, and particularly Black men. Can you share more stories about Black men and their health and the ways that they're not taking care of it right now?
Mm-hmm. So absolutely. So a lot of times when things happen in communities, we share the bad stories over and over. And those bad stories, such as Tuskegee experiment, such as seeing family members who don't get proper healthcare or proper treatment. And those stories are passed on from generation to generation, right? I wasn't directly affected by the Tuskegee experiment, but I was told by it by several family members. So you had that kind of perception. And when you talk about trying to get that community to trust in things, and you look at some of the Black men and how we have disproportionately higher rates of hypertension, diabetes, cholesterol, stroke, lung cancer, you look at all the things that we suffer from. And then you have me as a healthcare provider sitting looking at all of the treatments now that we can do to prevent these diseases, to treat these diseases, to minimize these diseases. And you see people not utilizing the services and really have to find a bridge as to why are people not utilizing them? And being in a unique position where I can see a lot of Black men, whether that's through football, through barbershops, through the Black Nursing Association, or through just walking and really paying attention in my community. And a lot of it, when you start speaking to them, like the story I told at UNGA, talking to a young man who, it just so happened that my barber, who's my fraternity brother, he knows my history as a healthcare provider. And he knows that another one of his clients was having stomach issues, or what we call GI issues. And he turned me around in a chair and was like, hey, why don't you talk to Dr. J about it? And at first the guy realized, he's like, you're not a doctor. You don't have a doctorate. And we're laughing. And I'm like, no, I do. So as we start having a conversation, he's like, oh, wow, like you really are. You know what you're talking about. I understand. Then it becomes immediately more comfortable because he's met me somewhere where he feels safe at, which was in the barbershop. So as we start having a conversation, I start troubleshooting. And I really was asking him, why didn't you ask some of these questions to your provider? And his response was just, I feel like I'm being rushed in and out. And for me, as somebody who does primary care, I do understand that there's a time limit on all of our office visits, even if we don't say it out loud. A lot of times you're trying to get people in and out in 15, 20 minutes. Us being at the barbershop, he's waiting to get a haircut. I'm getting a haircut. We don't have nothing but time at that moment. So for me, it was, let's capitalize on this time so you can ask me these questions. And then because I'm in the barbershop and I enjoy being in the barbershop because it's relaxing, after I finish my haircut, I sit in the chair next to him and we just continue having a conversation while he's getting his haircut. So really being able to utilize those spaces to make up time that we normally don't get and get people comfortable in asking questions about their health. And a lot of times Black men don't feel comfortable asking those questions.
You raise a lot of important points. Can you share some very specific data points about Black men and their health?
So some specific data points. Black men are less likely to seek visits or have follow-up visits. They're more likely to have certain diseases compared to the other gender, racial demographics, meaning a lot of times Black men will be at the bottom of the poll, especially when it comes into seeking care. And you'll hear people say things like, a doctor's office is open from 9 to 5. I work 9 to 5. How am I supposed to go see the doctor? And they'll also say, if I call out to go see a doctor, that's me utilizing sick time, vacation time that I normally don't have. And when I look at it like that, I'm thinking, damn, this is true. Like, why would I use my vacation time to do it? I've had patients who, if they had to go see a specialist and they had to get an accessor ride, it meant that they were being dropped off at 9 a.m. and sitting at the doctor's clinic until 4 or 5 p.m. And for them, they just wasn't doing that. And then
that doesn't work in anybody's life.
Right? It becomes an all-day event.
So what are some of the novel approaches and the other safe spaces that you find are a really good place and time for you to reach people and for them to access you that might help them to pay better attention to their health?
My biggest novel approach is to make sure that I am prepared to take whatever they throw at me because I'm a healthcare provider. Meaning there are things that the healthcare system did to them, did to generations of their family that makes them distrusted. So when we start the healthcare conversation, oftentimes I get that thrown at me as if I'm personally responsible. What I do, because as a healthcare provider, that's something that I have to own. Even though I had nothing to do with it, I have to own because I'm a part of that system, right? And a lot of times when people have historical issues, there's always this comment of, oh, but that wasn't me, that wasn't my people, I didn't have anything to do with it, I'm just representing them now. But I understand that when I own it and say, yes, we did that and we made that mistake and that was wrong, it kind of unarms them for us to start having a conversation. The other novel approach is to understand that we're going to have multiple conversations. I'm not going to change their mind overnight. I'm not going to change their mind with one conversation, no matter how long it is. I have to get back in front of them to have that conversation. Those two approaches are really my biggest practices because I realize that it builds a relationship with those men. And as long as I can build a relationship, we can have future progress. Some of those places where I meet them at to have these conversations, as mentioned already, the barbershop, but also the football field, we'll start having conversations, especially as some of the coaches get older. We can talk about certain things. Some of the parents will pull me to the side sometimes and ask me because they all know now, like, oh, that's Dr. J. So they'll ask me questions about them. I get to have conversations with the young men as they're growing up. I'm in a unique position where our youngest kids on the football field are 6 to 7, and our oldest kids at the moment are 14. But then I also get the alumni that come back. So utilizing that space. Utilizing church spaces. We had a meeting at Church of God, East New York, where we're working on a grant for the All of Us research project through NIH. And at the end of it, I told them, let's have this open dialogue where you have unprecedented access to a healthcare provider to ask me whatever you want to ask me, right? And let me make time for you. And we had a great dialogue there afterwards, where some of the people were just like, your approach is amazing. And really, a lot of times, my approach is just really to listen and to honestly be patient and let them make their own mind up.
Let's talk about All of Us. Explain what the All of Us program is and specifically why it is so important for communities of color to be a part of it. Absolutely.
So National Institute of Health All of Us research program aims to be the largest, biggest longitudinal study ever created in America in terms of the amount of enrollment of researchees. And the goal is to make it the most diverse research group ever. And they understood that there's been a problem historically with research that it has really only focused on the white population, specifically white males. And they want to create more research opportunities in order to create what they call precision medicine. Because although we are all very similar, we are very much trying to create medicine, healthcare approaches that can be individualistic. And in order to do that, we need as diverse as a group as possible. So we started working with All of Us back in 2018 as a chapter. And we've had a bunch of different events within the communities. We've had enrollment events at schools of nursing where we talked about it. And it's important to me because it gets a chance for us to, going back to what I said, when we have to own it as the healthcare system to say that this was our mistake, it gives us a rare chance to correct that wrong. Mm-hmm. And one of the things we also told them, a lot of people know now about Black maternal mortality and how Black women die at 3 to 4 times rate higher. If we want to go do a research on why these women were dying at higher rates, but the only women and children and significant others and family members that we pulled were non-Black people, we would never get to the bottom of that answer. So in order to get that answer, we have to sign up. And then another thing I told them was that when they sign up, you also have to make sure that you hold us responsible as your Black and brown scientists. Meaning if there's something that you want to know or research to, you need to come to us and say, hey, National Black Nursing Association, National Medical Association, we want research on this issue that's affecting our community. And then those researchers in those groups can then go to the All of Us research group and start that process of saying, okay, we're going to look at and identify this. And I think for a lot of them, when they heard that, they were really surprised and shocked. And they also understood that this is a chance for us to take back the narrative and control it and control what we sign up for and want to participate in.
So when you sign up for, I want to give a lot more clarity on this because we're talking about signing up to be a research participant. And the type of data that the All of Us program is looking at is really trying to understand our lifestyle, our environment, how that affects our health. So when you enroll as a participant, what does participation actually mean?
Absolutely. So that, funny enough, that was one of the questions that was asked. And first thing I told them was, a lot of times when people hear the word research, they think, I'm going to give you a medication and watch how that medication reacts in your body. That's not what this is. And then I started explaining to them that there's different types of research. There's some research where you answer questions in a dialogue. There's some research where you answer surveys. There's some research where they just watch your progress, and letting them know that it's your genomic data, right, that you're signing up and you're giving them access to. But then also you have the right to say, when they ask you, hey, do you want to be a part of this study? You can say no. Or you can say maybe, or you can say, yes, I want to be a part of it. And a lot of it is filling out surveys, and nobody is giving you anything that's going to affect your health. So making sure that we explain that to them was critical.
You also mentioned meeting people out on the sports field. What a great opportunity to meet young men, particularly young Black men and their family, and a moment in time, oftentimes when we don't see them in healthcare settings. We only see them when they're injured or when they're really sick. So those years between 18, when they become an adult and their parents frequently aren't taking them to any type of health type of appointments, next time we see them is in the emergency department when they're clutching their chest because they have a heart attack. So, there's just this wonderful window out on a sports field. And I'm thinking very specifically with you with football, we have a great moment to talk about heart health because of Damar Hamlin. I don't think this is the way he wanted to sign up to be a spokesperson for CPR. He very much credits the trainer who was out on the field for saving his life. And if anybody had any questions about whether or not CPR saves lives, we could not have asked for, and nor would we have wished for, that type of national spectacle, really, of seeing CPR in action and seeing how that works. But given that we do have this really powerful story to show what CPR in action looks like, how are you using this powerful story to help people think more about prevention and screenings and learning basic CPR skills? It really affected people in so many different ways, but it sounds like you've got some interesting projects and programs that you're going to be working on with Damar to reach young men about heart health. So share that story.
Absolutely. So with Damar Hamlin, when he had the sudden cardiac arrest on the football field, it brought me back to a moment when I was in grad school, and we had two young men who were play fighting, play boxing, and one of them suffered a sudden cardiac arrest at that moment. And we lost him that day, a young man by the name of Andy. Having that always in the back of my mind and then seeing what happened to Damar in my head said, all right, this triggers a moment where we need to do something about heart health. We need to educate men on it. We need to teach them CPR. And really for me, use the CPR as a way as a door opening to have a broader conversation on heart health and your health in general. So one of the things that I'm working on is putting together the ability to teach and starting off with youth coaches. And I'm going to use my youth football organization as kind of like the example to teach youth coaches how to do CPR, parents that may want to learn as well, and then having a conversation about sudden cardiac arrest, heart health, and other men's health, primary care health, and really open it up to ask questions to everybody. Okay, tell me, what do you know about sudden cardiac arrest? Explaining what that is. What are your questions surrounding it and what happened to Damar Hamlin and how we could prevent that on the field? And then going from there to say, okay, what other questions you may have for a primary care provider now that you have me here, which is what I always sneak in towards the end of any conversation I have with them, because I know it might be somebody that wants to ask that question and somebody else who has it on their mind and too scared to ask the question. So using the conversation to teach them a necessary thing in terms of CPR, heart health, then opening that door to a broader conversation on primary care and why you should be seeing your primary care provider at minimum annually. And then the goal is really to spread that to other organizations. So we have the Brooklyn Skyhawks that I'm going to use. I have a great relationship with the Bronx Knights Football Club. out in the Bronx. So hopefully we didn't spread it to them. And then really my goal is to spread it everywhere that needs it. Anybody that is open to it, I want to have this and give them this program where, hey, look, yes, I'm going to train you to do CPR, but we'll do some heart health and we'll also answer primary care questions. And then hopefully we can connect you to health and put you on that continuum where you are taking care of your health.
The other piece of that story we don't frequently get to share is pre-hospital care. When we think about our emergency services and out in the public spaces, people have all sorts of events. And so how do we, as citizens or as people who are overseeing facilities, our public spaces, thinking about the preparedness? Because at any moment in time, something like this can happen. When you're talking to schools and you're talking to different sports programs or different public health spaces, churches, barbershops, what are some of the things that you're sharing with them to help make our spaces safer in the event that there is an emergency event?
I think right now, a lot of those spaces aren't safer in terms of they've just never had access to it. So they understand the importance of it because we've all had people that died, right? And now when I utilize the Damar story, it's going to be me leaning on how do we prevent this? How do we prevent this? Sorry about that.
No, you okay?
Yeah, I'm okay.
I'm not there to give you CPR, so I'm going to have to talk you through it.
I also understanding that doing CPR can feel overwhelming, especially if you've never done it, especially if it's been over dramatized on TV, and really just talking to them about, all right, let's go through it. Let's practice it. Bringing the proper mannequins for them to actually feel it and what that may feel like. So that when you, and because I'm a coach, I believe in repetition, right? I want to make it so that whatever happens in practice, when it feels the same way in real life when it actually happens. So making sure that they feel comfortable in doing that, because then they'll utilize it. And then hopefully that spans into a conversation also with healthcare and getting them to see primary care providers or getting them to see specialists, whatever is needed.
When people listen to this and there are other football coaches around and they're interested to bring some of your programs in, are you willing to share your playbook?
100%. I'm 100%. Tell them, let me know. We'll get on the phone. We can talk. If they want me to come out to where they're at, we can do that as well. I am here to disseminate everything I have to benefit the community, because as one of my good friends, Cam, has always said, you lose nothing by sharing it with people.
So JJ, how many people have you inspired or made it seem possible that they too can be a part of a profession and a system that is improving people's health and saving their lives? So
I would hope to say thousands. And that's just from, I have a chance every year to be in front of hundreds of football players and talk to them about things. Being a professor, I come across hundreds of students every semester. Being part of the Black nurses, we represent thousands of nurses, and we do things like go in communities and do career fairs, healthcare screenings, speak to people. So I would hope thousands. I've had a couple of people tell me that I inspired them to do things. Back in 2018, I did this thing one day where I told people, if you send me a picture of you, I'll write something about you and post it on my story. And it was a couple people who I had told, you're going to get your doctorate, you're going to become a nurse, you're going to do this in your field. And when I look back on it, I was like, oh, wow, there's a lot of them that are actually doing it. Like there's a friend of mine who told me he has his doctorate of education, and he told me, you're the first person I know that had a doctorate. And when you got yours, I knew that I can get mine, right? And I wrote about him back in 2018, and he's a principal now. I have another one of my fraternity brothers who came to LIU, and when he crossed the stage for me to pin him, he started crying on my shoulder. And he was just like, thank you for always believing in me. He was like, you've never given up on me. Even when I couldn't see it, you pulled me through the darkness. And I think that's our calling, right? If we're not going to inspire the next generation, then what are we really doing? And I just hope that I've given that back to others because it was done for me. There were people who carried me when I couldn't see the way.
JJ, I am so glad I am on your team, and I am here for all the coaching and the training that you have to provide. I am grateful for the future that I see with you as a leader.
Thank you. I appreciate it. It means the world.
Nurse practitioner and educator Julius Johnson is a board-certified family nurse practitioner, an associate professor, a football coach, and a guy who loves everything about spending time in a barbershop. He wears a lot of hats and helmets, including serving on the board of directors for the National Black Nurses Association, being an active fraternity brother, and being a girl dad. Special thanks to Johnson & Johnson Center for Health Worker Innovation for permission to share JJ's story from their Stories from the Heart of Health event. And speaking of hearts and health, CPR, man, did the world get a masterclass in how it's done, that it works, and that it saves lives. When pro football player Damar Hamlin, a young healthy athlete, suffered cardiac arrest during a televised game on January 2nd, 2023, 1 million viewers grew to nearly 24 million viewers as news of his injury spread and people tuned into the coverage. The world followed his care, celebrated his recovery, and the scene brought to light just how vital CPR and first aid care can be. The American Heart Association reported a 200% increase in the web traffic to its CPR site, which is a good thing because many surveys indicate that only about half of Americans know CPR. Less than 20% are up to date. And research has shown that CPR training is conducted less often in Black and Hispanic communities than in white communities, and that Black and Hispanic people are less likely than white people to receive bystander CPR at home or in the public, which leads to lower survival rates after cardiac arrest. Recognizing this unique opportunity to start and deepen conversations with Black men about their heart health and safety, JJ, like he has in similar instances, takes his nursing and coaching credentials to the places where Black men feel confident and welcome. And right now, CPR is the way to kick off what he hopes will be conversations about their broader health, about preventing disease, getting them into primary care or specialists, whatever is needed to get Black men to take better care of themselves, live better and longer lives, and reduce their health disparities. As JJ says, as long as we can build a relationship, we can have future progress. And now for that follow-up conversation with JJ we promised at the top of the episode. This is such a wonderful time to be having this discussion. As I was thinking about February, it's such a mashup. I mean, it's Heart Health Month, Valentine's Day, the football Super Bowl, and Black History Month. And so I was thinking, oh, the best person to have this conversation with to connect all of these dots and help us to understand how all of these celebrations and observances intersect. I thought, well, got to talk with JJ, Dr. J, Julius Johnson, who is taken on, oh my gosh, so many areas around health equity and with a really strong focus on Black men's health. So let's begin with, how does heart health and CPR training, how have they become so connected to football?
All right. So we know that Damar Hamlin had a sudden cardiac arrest on a primetime football game. And we know that
he's a football player for the Bills, right?
Yes.
Number 3.
Buffalo Bills. Yeah. And football is always the most watched televised sport in America. So everybody saw it and everybody watched in horror in real time as the events unfolded. And thank God he made a full recovery, and thankful for the healthcare professionals that performed CPR on him. And then now he has transformed into this CPR ambassador, heart health ambassador. So people are much more cognizant of CPR and heart health. Right now, what I am doing is working on connecting people to think, all right, it's not just CPR that has to do with heart health, it's other things that go along with it, right? So when we have sports, We're looking at people who possibly have a sudden cardiac arrest, and how do we respond to that? Because that's not just CPR, right? It's about having availability of defibrillators for football teams to simulate sudden cardiac arrest responses, for them to understand the importance of being in a team and everybody having roles. We piloted a sudden cardiac arrest simulation. We didn't want to just teach people CPR. We wanted to teach people this is how you're supposed to respond. And when everybody gets together, know who on the team is doing what. Before every game, before every practice, y'all go over the roles of who everybody is playing in case something happens. So we talk about the emergency preparedness of it all. And then that also transformed into how do we be ready for other emergencies? When we had this training, it was, okay, I may not always be here as a nurse practitioner, so I want to make sure y'all are okay. But in the back of everybody's mind, it was still, well, you coach, so you're always going to be here. And then one day, right?
It's like you're trying to like hand it off to say, hey guys, you got to take some ownership here. I can't do it all.
And then as time will have it, one day we was playing in Roy Wilkins Park, which is in Queens. So I went to Roy Wilkins Park first. I didn't go to Brooklyn to practice before they left. And at the field, one of our kids collapsed because he was having a seizure. And the coaches called me afterwards and they were going, thank God you gave us that preparation. Because we were prepared for the worst possible situation, everybody had a role. They knew what they was doing. They're actually doing everything because it's been so trained and ingrained in them, right? That they realize we've done everything and the ambulance is already on the way, right? Like he's safe, he's okay. And they were like, oh, wow, the training actually worked, because you don't know the training works until your body naturally does it. Yeah. So it was one of those events where I was very sad that it had to happen, but I was very happy that one, the boy was fine, which I'm grateful for. And then two, the coaches responded appropriately, because they had that emergency preparedness. And then when they finally got to me in Queens, like they all just stopped and hugged me. And you know, a lot of men aren't emotional, but for them to stop and one by one hug me and say, thank you for this training. Because if it wasn't for this, we wouldn't be prepared to deal with situations like this, right? And now, go ahead.
I'm laughing when you're saying that men aren't emotional. I've watched a couple of NFL football games. I see a lot of emotion out there. JJ. I see a lot of hugging. I see a lot of high-fiving. They know how to bring the emotion. So I can imagine the joy of being part of saving a life. That's a really different hug than a hug from having won a game or Absolutely. Consoling somebody who maybe came out on the short end of that game. How many people are involved? How big is this program that you've been able to build? How, it started small and, it's growing.
So within like just the Scout Hawks, we have 4 teams. Every team has at least 5 coaches. And then we also have staff that works with us. And then we also have a parent coordinator for every team. So all of those people, right? So that's 30 plus people. It works so well that the commissioner of the entire New York City Youth Football League, now he's going, all right, we need to implement this into everybody. And he's like, what type of capacity do you have in order to do this? So because I'm blessed to have a partnership with Greater New York City Black Nursing Association, because New York University, Roy Myers School of Nursing is so willing to say, get out in the community to do that, we're now saying, okay, we can do that for the teams for this 2024 year. Well, we can do the simulation. We may not necessarily be able to buy all of them a defibrillator. I wish we could, or I wish we could find funding to make sure that we all have it, because that's the real gap, that community teams aren't CPR certified and they don't have the funds to buy defibrillators, right?
And it leads me to, you gave a really wonderful televised interview with the New York Post Sports, where you talked about how prepared and equipped, or rather ill-equipped, unequipped, that school-based youth sports programs are in being able to respond to any of these health emergencies. And I have to say, as I was listening, I was thinking back to my own time as a youth athlete, and then also my now adult children when they were youth athletes. And it really started to sink in. Gosh, this is just really complex to make play safe for all of our kids. So say more about what you've learned and what you're doing to address the complexity and gain yardage in this problem because, you're talking football, but we got kids in all sorts of sports, in all sorts of places. And the point that you made that really struck me is that so many of our kids are playing not in a school-based program that would have regulations, but they're over in a recreational league. And I'm also thinking about adults. I mean, once we get out of high school and college, we've got recreational leagues for adults. So it's a great, big, huge field out there that we need to be making sure that the field is safe for everybody to play. So I just opened up a great, big, huge can of worms for you to sort through and help us think about.
So we have this big push in America to get more active, to combat obesity. And to combat obesity, you have to be active. You have to work out, you have to play, you have to do these things. But then we also worry about sudden cardiac arrest events. But how are we trained to do it? So some people think, oh, we're just going to certify somebody in CPR and that's it. But we know from history that tells us a lot of people are afraid to initiate CPR if they're not a healthcare professional. And then we also know that some people may not have the funds to make their coaches CPR certified in recreational leagues. So when we look at it and I go, okay, so the common gap is being able to initiate CPR, but more importantly, understanding what's a potential sudden cardiac arrest event. So creating that simulation space to connect everybody and give them practice, because I believe people should practice in a safe space. Practice when making a mistake isn't going to cost you a life. Bringing awareness to that problem within recreational leagues, bringing awareness to the need for simulation within school systems, bringing awareness of defibrillators, and having everybody on the same page and keeping up the fight to spread more.
Well, let me just pick up on that. I mean, I think what's really fabulous is the beginning stage is the awareness. And Damar Hamlin, with his Lifesaver program, partnered with the American Heart Association. The big thing that they've talked about is turning every bystander into a lifesaver. And the American Heart Association has this wonderful playlist of songs that you can practice in doing one person compression only CPR. So what I took from that interview is we need to have everybody get over the resistance to deliver CPR, but having everybody certified isn't enough. You still need to have the protocols in place. You still need to have the equipment. So I think that goes back to organizations to say, all right, if we're doing this awareness campaign, what do we need to do as far as training, equipment, so that all of these bystanders who are now prepared to be lifesavers, they've got a setting and a set of equipment for it to be successful. What can you say about sudden cardiac death as far as its prevalence in youth athletes?
It's prevalent in certain sports, basketball being number one, football being number two. Then you have your lacrosse, you have your soccer, right? And we don't understand it. And I think at first when it happened to Damar Hamlin, there was this miseducation of this is a football problem and it comes from contact with football. Then when you did the numbers and it goes, well, actually basketball is number one. So if basketball is number one and they don't have the kind of contact that football has, right? And I would say as much as football is revered, from a safety standpoint, people love basketball even more.
Yeah. I think one of the things that's really important for people to know is that it's a low probability but high impact event. Yes. But we need to be prepared for it. And as far as a leading cause of death among young athletes, it is sudden cardiac death. And while it doesn't happen often, when it does, it is a really high impact event. So I think to your point, if we're prepared for the worst case scenario, we're so much better prepared for any case scenario.
I was going to say, and with it being that high impact event, it's also very preventable to prevent death from it if you have the resources. It'd be different if given these resources still didn't make any kind of significant improvement. But when you tell me you can increase somebody's chance greater than 80% of surviving by just putting them on the defibrillator, that tells me get them the defibrillator. Because now we know that, yes, this may not happen, but if it happens, we can then protect them. It's kind of like kids dying in car accidents. Some people may say, oh, I'm never going to get into an accident. You may be right, but put a seatbelt on them because we need it. So I think of the defibrillators like the seatbelt.
Yeah. when you think about during an election year when there are all sorts of policy matters on ballots and lots of conversations within our community about what our priorities are, our health priorities, our school priorities, educational priorities. You got any thoughts about maybe some of the questions that we should be bringing to town hall forums or voting forums or candidate forums on issues that are going to make play safer for everybody?
Absolutely. A couple of things. I think a lot of times people look at certain events like sudden cardiac arrest and they'll go, it's not really going to happen. So why are we even worried about it? Right? Or I'm not going to put X amount of funding into it. But when we link it to things like you want children to play for at least 60 minutes a day, you want children to be healthy and active, and the most active kids belong to team sports. So we are pushing kids to be more involved in team sports, to be more involved in physical activity. We should also be pushing to make sure that they do it safely. So we also should be pushing that if something happens to these kids that we have pushed to be active, we can make sure that they are going to be all right. CPR training, sudden cardiac arrest awareness, defibrillators.
School nurses.
Yes, but it has to be the whole package. You can't just say, we want kids to be active. And the more kids you push to be active, the more likely you are to have a sudden cardiac arrest event. That's how it goes.
I think what's super fun right now at this moment is that connection between heart health and football, but recently nursing and football. Pro football player Clyde Edwards-Helaire, he's a running back for the Kansas City Chiefs. Mm-hmm. He announced that he's pursuing a nursing degree. So I'm thinking to myself, JJ, man, you got a club going here. So how many football players are nurses?
There's a good amount of us, people who used to play football that are now into nursing. I think that it's a natural transition. Football, the greatest team sport, because it is the sport where one individual cannot win you a game, no matter how many people try to elevate one individual above the team. So you're naturally going to be a team player. You naturally have to care about other people if you're going to be successful. And you naturally have to do a lot of hard work if you're going to be good. All three of those easily translate into being a nurse. Being a nurse means you're going to be a part of a team, you're going to have to do hard work, and you're going to have to care about other people other than yourself. And you're going to have to sacrifice for others as well. So I think it's a natural transition.
I love that. So are we out on the fields recruiting more?
For nurses?
Yeah.
Absolutely. I am a walking recruitment of nursing when people see me.
Oh, good. I want to stay on this heart health topic, but I want to switch our attention to women. So during February, Heart Month, the CDC reminds us to pay particular attention to women and their cardiovascular health. I think it's like nearly half of U.S. women do not recognize that heart disease is the leading cause of death for women. And then when we start adding in heart health disparities for women, that they widen and they deepen when you combine it with race and ethnicity and all other social factors. So lay it on me, JJ. What should me and my girlfriends be doing to take better care of our hearts and to avoid the delayed recognition and the diagnosis and treatment for cardiac conditions that women routinely experience?
So you have the awareness, which is the easiest answer. The awareness, the education, but then that doesn't break down into specific. So specifically, one of the things I think women should do when it comes to heart is to not ignore their symptoms for other people. And what I mean by that is that women are the thread of society that holds us together. And as a man who has been raised and influenced by a bunch of phenomenal women, I'm not afraid to say that. And although women are great about going to their doctors, sometimes they will forego things because they have to do something else for other people in the family, right? Other people in the community. I need y'all to stop and take care of yourself as well as y'all take care of us, right? Because I do get that, right? And I see it in all sorts. I see women who are worried about their child going out into the world, right? Worried about how well they're going to do in school. Women worried about their child surviving it. But I need y'all to also worry about yourself and prioritize yourself. And then I need the rest of my men to also step up and say, okay, we're going to protect them, right? As well as they check on my well-being, I need to check on your well-being. Have you seen your primary care provider? Are you taking your medications? What medications are you taking so that I can help assist you and say, is this all right? Is this the way you're supposed to be feeling? the same way that y'all show up to everybody else's doctor's appointment, right? Like women that show up if their husband is at it, they show up if their kids. But when it's the women, chances are it's just them at their own appointment. So I need us to show up for them as well.
That is really great, practical, and very loving advice. My heart feels better just hearing you say that. So anyway, I just wanted to say I am so grateful, so impressed. And I keep seeing all of these extraordinary things that you are focused on in making sure that we all have healthier hearts, healthier lives, healthier relationships, taking care of our communities, taking care of our youth. There's like nothing that you're not touching on, JJ.
Thank you for always making space for me to share this platform with you and be on and spread what we're doing. I think you're doing a phenomenal job. I'm happy that we have this kind of voice in nursing that can really reach out to people. And you have such a unique voice that when it pops up, people listen.
Thank you, JJ. For See You Now, I'm Shauna Butler. Thank you for listening.
Nurses are transforming healthcare through innovation, compassion, and leadership. And Johnson & Johnson is proud to continue its 125-year commitment to champion nurses through recognition, skill building, leadership development, and more. The American Nurses Association is dedicated to building a culture of innovation. Nurses improve the lives of patients and communities through innovative thinking, empathetic connection, scientific rigor, and sheer determination. ANA is proud to support and advocate for our nation's most valuable healthcare resource, our nurses. For more information on See You Now and to listen to any of the earlier episodes in our library, visit seeyounowpodcast.com.